Adriana Nottingham. I am the nurse practitioner student, and today I'm going to assess your musculoskeletal system. How are you doing?
I'm good.
Great. Patient is alert and oriented. She is well cleaned and groomed. No signs of acute distress. So I'm going to have you look at me. I'm going to touch your face. No swelling or redness. Now I'm going to have you open your mouth. Move your mouth around, stick your tongue out. Any pain or tenderness as you were doing that?
No.
No pain or tenderness or snapping or clicking, so negative for TMJ. Great. So I'm going to stand up. Palpating your shoulders. Any pain, tenderness?
No.
Down to your forearms, your wrists, your hands, your fingers. Any pain or tenderness?
No.
No pain or tenderness noted or deformities, which is great. Now we're going to do your range of motion of the upper extremities, so just follow what I do. Flexion, extension, abduction, adduction, touch to your shoulder blade, internal rotation, put your arm out and up, external rotation. Great, put your arms down. Now you are going to do the drop arm test. So reach your arms up, slowly lower. Any pain or tenderness as you were doing that?
No.
Your arms move bilaterally, symmetrical together, no pain or tenderness, so you are negative for a rotator cuff. Now I'm going to palpate your elbows. Have you flex, extend, flex, and extend. Any pain or tenderness?
No.
Great, into your other side. Flex, and extend, and flex, and extend. Any pain or tenderness?
No.
No pain or tenderness noted. No signs of crepitus, dislocation, erythema, or swelling. So I'm going to have you, your palms up, supination, and down, pronation. Range of motion of your wrists. So put your hands down, flexion, and up for extension. And turn your hands inwards, radial deviation, and outward, ulnar deviation. For your fingers, I'm going to have you make a fist for flexion, open, extension. I'm going to have you spread your fingers apart, abduction, and back together, adduction. And now I am going to check your thumbs. So put your thumb to your fifth finger for flexion and relax for extension. Lift your thumb up for abduction and down, adduction. And have your finger just slide across your palm for opposition, as well as touching all fingers. Great. So for Tunnel sign, I'm going to tap the medial nerve of your hand. Any numbness or tingling in your second, third, or fourth fingers?
No.
And the same for the other. Numbness, tingling, second or third, fourth finger?
No.
Negative for Tunnel sign. And for Fallon sign, flex your wrists. Hold that there for a minute. The minute is up. Any numbness or tingling in your second, third, or fourth fingers?
No.
Negative for Fallon's and Tunnel signs, so you do not have carpal tunnel syndrome. For your back, I am going to assess your spine, palpate, don't feel or see any masses. Keep your arms by your side, have good posture. Your shoulders are equal, no curvature, so you are negative for scoliosis, lordosis, and kyphosis. So for your cervical range of motion, go turn to me. And I'm gonna have you touch your chin to your chest and back up. Look to the sky, extension. Gonna turn to each side, rotation. Touch your ear to your shoulder for lateral bending. That is great. I'm going to palpate your joints, starting with your facet joints, down to your spinous process. Any pain or tenderness?
No.
Your sacroiliac joint, any pain or tenderness?
No.
Hip joints. Your paravertebral muscles, any pain or tenderness?
No.
Great. Now I'm gonna have you face me again. And we are going to check for your spine range of motion. So I'm gonna have you touch your toes. Reflection, back up, go all the way back. Extension, you're gonna turn to each side without moving your hips. Rotation, and put your hands on your hips and just bend to each side without moving them. Lateral bending. Now we are going to move on to your lower extremities. So that includes your gait. So I'm just gonna have you just walk normally. And walk back the other way. Patient has a normal gait with smooth, continuous rhythm. I'm gonna have you have a seat. I'm gonna palpate your legs. Any pain or tenderness in your calf muscles or anywhere that I'm touching?
No.
No pain or tenderness in calves. So I'm gonna have you lay down. For your hip range of motion, I'm going to have you pull your knee to your chest for flexion. Now try to pull against me. Great. You can lower it. I'm gonna have you dangle your leg, straighten for extension. Now try to go against me. Great. Going to go to your other side. Pull your knee to your chest again for flexion. Go against me. All right. You can lower your leg, dangle it to the side for extension, straighten, and try to go against me. Great. Gonna have you take your leg out, abduction, try to go against me. All right. And bring it in for adduction. Try to go against me. Abduction. Try to go against me. Okay? And inside adduction and try to go against me. All right. Now we're gonna bend your knee like that. I'm gonna turn it in internal rotation. Try to go against me. All right. And external rotation and try to go against me. All right. Do the same for the other leg. Internal rotation, try to go against me. And external rotation, try to go against me. All right. Now, we're gonna do the McMurray's test. So I'm gonna have you bend your leg. And I am going to palpate your lateral and medial joints. And I am turning your leg internal rotatedly. I'm going to extend. I'm going to put it back regular. palpate lateral and medial joints again. I'm gonna externally and straighten and extend again. No snapping or popping, which is good, so you are negative for a meniscal tear. And do this leg. Palpate the lateral and medial joints. We're going to turn internal, extend the leg, extend. We're going to straighten. Still palpating the lateral and medial joints. We're going to externally rotate and extend. And extend. No snapping or clicking, so negative for a meniscal tear. Now I am going to do the drawer test. So you bend your leg. I'm going to sit on your foot. And I'm grasping the tibial joints. And I'm going to pull. Any pain, tenderness? No laxity. So negative for ACL tear. No push. Any pain?
No.
No laxity, so negative for a PCL tear. You could lower that leg. And then this. Yeah. Palpating the tibial joint. I'm gonna push. Any pain?
No.
No laxity, so negative for ACL tear. And pull. Any pain?
No.
No laxity, so negative for PCL tear. Alright. For the straight leg raising test, I'm going to keep your legs just like that, and I'm going to slowly raise them. Did you have any pain or tenderness as I elevated it past 30 and 60 degrees?
No.
Same for the other side. Slowly raise. Any pain or tenderness as I slowly raise 30 to 60 degrees?
No.
Great, so negative for a lumbar disc herniation. Now I'm going to have you sit to the edge of the chair. For your knees, you are going to bend, flexion, and straight for extension. So lower it. Try to flex. Bend your leg back against resistant. Great, and straighten it against resistant. Great. Well, for the other side, bend for flexion, straight for extension, against resistance, flexion, and extension. Great. And for your feet, I'm gonna dangle them kind of. Put your toes down for plantar flexion and up for dorsiflexion. Put them down against resistance and then up, resistance. Great. For turning your feet, your heel inward for inversion and outward for eversion, and then putting your front foot inward for adduction and outward for adduction. Great. So your assessment went well. Do you have anything that you need to tell me? Any issues or complaints that we need to go over?
No.
Great. If anything else comes about, just let me know and I will be happy to bring you back in. Thank you.
Thank you.